Hi, everyone. My name is Dr. Christine Greer. I'm an ophthalmologist with specialty training in neuro-ophthalmology, and I am here to teach you about eye health. Now, why is your eye health relevant? Having good vision and feeling confident in order to execute all your daily activities is extremely important, not just for your cognitive function, but also for your medical health. Having good vision reduces the risk of falls in older individuals and keeps you engaged with the world, your friends, your family members, and can really improve the quality of life for people in their later years. Better visual acuity is significantly correlated to a lower dementia level. And poor untreated vision is associated with a 9 times higher risk of developing Alzheimer's disease and a 5 times higher risk of developing cognitive impairment. Also, memory scores have improved after cataract surgery, and this has been shown in multiple studies. And there's also imaging studies, MRI imaging studies that show brain volume expansion after cataract surgery and vision improvement in some individuals. So, what can you do besides going for your yearly exams to improve your eye health? Well, keep your eye wet, moist, use lubricating drops, use your warm compresses, make sure you're staying hydrated, you're getting good sleep. Consider taking vitamins. They make eye vitamins over the counter. They have lutein, zeaxanthin. These are different antioxidants that can help with your macular health. And last but not least, especially if you're in South Florida or another sunny area, make sure you're wearing your sunglasses. We know that UV light increases your risk of macular degeneration and also cataract formation. So, what are some common conditions that can affect your vision as we get older? I would say the most common condition that occurs as we get older is dry eye. Dry eye definitely causes blurry vision. It causes redness, pain, itching, gritty sensation. And as a comprehensive ophthalmologist, it's definitely one of the most common complaints I see. If your dry eye is more severe, you can always talk to your optometrist or ophthalmologist about different prescription medications. You may be seeing commercials on TV. There are a lot of different drops that we can use to help your eye produce its own natural tears. So that would be something to look into if the more conservative measures are ineffective. The second most common condition I see associated with aging are cataracts. A cataract is when the lens inside the eye will become blurry with time. Proteins deposit in the lens turns like a brownish green, and it becomes hard to see through. Cataracts are more common in people who smoke, who have diabetes, with a family history. Other types of medications can accelerate cataract formation. Those individuals who take steroids or have steroid injections for arthritis or different back problems. So, if you're noticing blurry vision, it's really important to see your eye care professional to rule out cataract as a cause. Cataracts can definitely cause problems with night vision, driving, and these things are a matter of safety. Individuals who have cataracts are more likely to fall. If you have a cataract that is viewed to be problematic and affecting your daily activities, then you would require a surgery, a cataract surgery, which thankfully in 2025 is a pretty routine surgical procedure that's done in an outpatient facility and usually takes just about 15 minutes to perform. And the downtime is pretty minimal. So it's important to get evaluated for that as a possible cause for vision loss. Many individuals, as we get older, can also develop something called glaucoma. You've probably heard the term. You may or may not know what it entails, but basically, glaucoma is a condition that affects the optic nerve. The optic nerve is the cable that takes information from our eye to our brain. And when you develop glaucoma, the cable thins and it affects your peripheral side vision. So most individuals who have early glaucoma do not know because we're really using our side vision to sense motion. It's not going to stop us from reading a book or watching TV. And for that reason, some individuals don't see a professional for help. And then the vision slowly worsens and the visual field which you see clear constricts until you're seeing only like the central part. It's like looking through a straw. It's extremely important to see an eye care professional, yearly to rule out a condition like glaucoma. Thankfully, early glaucoma can be treated. We use drops to lower the eye pressure to slow the progression of glaucoma. So most individuals I see on a yearly basis don't lose too much of their vision, if any at all, because they're seeing me on a regularly scheduled basis and taking their drops to help prevent any problems from the glaucoma. It's really important to keep this in mind also. It's the second cause of blindness worldwide, cataract being the first, but glaucoma is the second. And finally, very common as we get older, but macular degeneration. Most people have a friend or family member that have macular degeneration, or most people are familiar with the word. What does macular degeneration mean? Well, the center part of your retina, the retina is the back part of the eye that has the cells that sense light. The macula is the most center part of that structure. It helps you do your fine focus, color vision. This is how we read. This is how we drive. When the macula ages, we can get little age spots or calcifications in those cells that sense the light. And when you have those calcifications, the cells can sort of die off. And this is what macular degeneration is. Early macular degeneration, thankfully, usually isn't too serious. If it affects the vision, it may affect the vision minimally. But as it progresses, it can start to cause blurring or missing spots in your central vision. There's two forms. There is the dry form, and there's also a wet form. The wet form occurs when little blood vessels grow under those light sensing cells and they can break and cause bleeding. Thankfully, there is a treatment for that, and we can use medicines to prevent the bleeding from getting worse or to cure the bleeding.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.